Good morning, Virginia. This is Virginia This Morning.
This segment featuring the art of medicine is sponsored by the Medarva Physician Network. To learn more, visit medarva.com.
There's a boxer brief battle happening this June at Rockets Landing, and it's all to bring awareness to colorectal health. We're here with Dr. Andrew Vorenberg this morning and Melinda Conklin. She's with Hitting Cancer Below the Belt, and we're so glad that both of you could join us today.
Thank you for having us.
Yeah, it's our pleasure. This is a big event coming up in June. We're talking about it now because March is Colon Rectal Health Awareness Month. Is that right, Doctor?
That's correct. Colon cancer is the second leading cause of cancer-related death in this country. And people just don't talk about it like they talk about other types of cancers. And we're just trying to bring some awareness. And every March is Colon Cancer Awareness Month, and this year we have a new event to talk about.
Now, you've been on with us before, and we've really talked about this and talked about getting over the speed bump of the taboo, really, of talking about getting checked.
Right. It's uncomfortable for people to talk about their bowel movements, but that is, what I talk about every day. So for me, it's no big deal. But to get people over the fear of having a colonoscopy is tough. It's an unknown quantity. People just don't know what happens during colonoscopy. It's a very simple procedure to have done, and it's a potentially life-saving procedure.
Really important to get checked out and make sure that you're having that done. We'll come back and talk about the specifics of who kind of needs to come in and really see you. But Mindy, I want to touch base because the event that's coming up in June, tell us about this. This really kind of blows the lid off of not talking about it. It's a boxer brief battle.
Absolutely. My late husband passed away 2 years ago due to colon cancer, and I've just been driven to find some kind of an event to bring awareness to colon cancer here in Richmond. I believe this is the first colon cancer event or campaign in the Richmond area, and I've been very blessed to have met Dr. Andrew Vorenberg, and he has joined the committee, and we have created a nonprofit, Hitting Cancer Below the Belt, and the first event is going to be the Boxer Brief Battle at Rockets Landing on June 8th. And it's all about raising awareness about colon cancer prevention, providing education, and just and bringing some hope and inspiration to the patients, the survivors, the caregivers, the loved ones left behind. It's just really a time to talk about colon cancer and embrace each other.
Who is the typical patient, and then maybe who does need to be seen?
Right. The typical patient that needs a colonoscopy is anybody over the age of 50. That's the guidelines state that people over the age of 50 should have a colonoscopy, and that's because colon cancer can be a silent killer until it's already spread or grown to a size where you need a colectomy, part of your colon removed. You have no signs. So a colonoscopy can be a life-saving procedure to remove the polyp before it becomes a cancer.
And that's critical to do early because there is good prognosis.
Right. If you can catch it at an early stage, well, first of all, if you can catch it as a polyp, there's no chance of dying from colon cancer. But if you can catch it at an early stage, there's a greater than 90% chance that you can survive colon cancer. And to speak to the point you brought up earlier about appreciation for this event, I've been mentioning it to my patients who are getting a sigh of relief from talking about this and talking to their family members about getting screened, and their friends that have supported these folks in their fight against cancer are all joining the battle here.
I guess I would be remiss if I didn't talk about our cushion care. You mentioned talk about bringing some lightheartedness to this. Just mention these pillows for us.
We have brought forward a new product to the market. The colon pillow says, "My colon used to be this long." And we also make another pillow that says, "My baby used to be in here," and that's for patients who've had a C-section, and it brings some lighthearted nature to C-section operations.
Thanks for coming in, you guys. We appreciate it.
Jessica.
Thank you very much.
You can find out more information on Dr. Andrew Vorenberg and Colon and Rectal Specialists by going to crspecialists.com or by giving them a phone call at 249-2465. And that Boxer Brief Battle 5K run is Saturday, June 8th, so save the date. It's at Rockets Landing. For more information, you can visit hcb2.org.